So what is breast reconstruction and when is it needed? We normally reconstruct the breast for cancer and for indications other than cancer. When you have a tumor in the breast and you remove it, if the loss of the volume of the breast is around 20% and less, then what we do is we do some sort of local manipulation within the breast, which is called Oncoplastic Breast Surgery. Today I'm not going to talk about Oncoplastic Breast Surgery, but I will be talking to you about breast reconstruction when we remove more than 20% of the breast volume. So when we remove this volume of the breast gets disfigured. So the only way to replace this structure is to take tissue from other parts of the body. We can do it in two methods. One is either put in an implant, which is not recommended for cancer because you cannot give radiation with an implant within. So what we do ideally is take tissue from some other part of the body and transfer it into the breast. In most centers in India, what they do is transferring muscles. This is an older form and an older technique of breast reconstruction. The most common muscle used is the latissimus dorsi muscle, and the other muscle which is used is the rectus abdominis muscle used for reconstruction. But today you don't have to use these good muscles which are meant for other purposes like swimming, etc. You don't transfer muscles at all. All what you do is to take fat from other parts of the body and transfer it into the breast. Now the problem when you do this is that you need this fat to be vascularized. So for which we either do a CT angiogram or with the help of a Doppler, find out where exactly these blood vessels enter this fat, either in your tummy, buttocks, inner thigh, etc. The commonest site where we have the maximum amount of fat is in your tummy. So what we do, we dissect. The main vessel going in there is the inferior epigastric artery. We dissect this artery and the vein, take out this fat from your tummy, transfer it onto the breast, reshape it, and stitch this artery of the abdominal wall to the arteries of the breast, like branches of the internal mammary, the lateral thoracic, or the thoracodorsal vessels. So once you have transferred this fat onto a new area, it gets its blood supply from this new blood supply, and the fat is preserved. We monitor this fat very carefully every hour after surgery, and if everything goes well, there is no need for an intervention. The total period a patient has to stay is the same as for a standard mastectomy. The advantages are many. You have a breast which is completely reconstructed, and you also have an additional advantage of a tummy tuck-in. Occasionally, you will find girls with very little fat in their tummy. But then these ladies have a little more fat either in their buttocks or in the inner thigh or in the back. Based on our anatomy, we can transfer this fat, maybe with a muscle too, onto the breast to reconstruct the breast. When you transfer autologous tissue, that is your own tissue, there is no rejection, there is no complication, and it is permanent. If you have any questions, you feel free to ask me. Yes, we already received a few questions. Let me answer them. Will reconstruction interfere with chemotherapy? 90% of the times, reconstruction does not affect chemotherapy unless you have a problem during surgery, like infection, loss of the implant, etc., where there may be a little delay in starting chemotherapy. But otherwise, there is absolutely no problem giving chemotherapy with reconstruction. What is the quickest way to recover after surgery? The answer for this is common after any form of surgery. All what you need is good, quick mobilization, exercise, nutrition, and prevention of infection. How will aging affect the reconstructed breast? Age does not affect the reconstructed breast at all. But the type of reconstruction changes depending upon the age and whether the breast is pendulous or not. Occasionally, we do breast augmentation on the opposite side if needed, if there's too much of a big difference between the size and position of the opposite breast. Are surgical drains used in the process? Yes, we always use drains after surgery to prevent any blood from accumulating or seroma formation or lymph, because these are all sources for future infection. What kind of anesthesia is used during reconstruction? It is always general anesthesia. We can't do reconstruction under local anesthesia. It may be very painful. Is blood transfusion required? We normally don't use blood transfusion. If you have a hemoglobin around 11, it's good enough, because the thinner the blood, better it is for circulation within the flap. If using a tissue flap, will there be pain, scars, or other changes in the parts of the body where the tissue is taken from? Yes, you normally find a scar, but this scar is normally hidden within certain areas. So that is not much of a problem. The pain of surgery will be there for a few weeks, which disappears over a period of time, bearable in most cases. Other than that, there's no other change. What are the risks of complications? This is a very important question. It all depends upon the experience of surgeons doing this. This is a very technical operation, requires a lot of expertise, and I'm happy to tell you that in our hands, the complication rates are less than 2%. Partial flap necrosis can occur in about 2 to 5% of patients, but a total loss of flap occurs in less than 2% of patients. But remember, there is absolutely no danger to life. Yes, Nahar, there's another question. How soon after mastectomy can breast reconstruction be done? You can do it at any time. We normally do it at the same sitting. So it's one continuous operation. So the lady does not feel the loss of a breast at all when she comes out of the theater. The breast looks exactly the same as to what it was earlier. There are some women who delay this reconstruction, maybe because of the thought of the cancer or financial reasons. For such women who still want reconstruction, we can do it even after about a year or two after surgery.
Can we talk about cancer in breast reconstruction?
The other question is whether breast reconstruction can be done in all stages. Yes, it is advisable to think of reconstruction, also considering the overall period of life this patient would go through after treatment. If you come in stage 4, it obviously is not an indication for breast reconstruction, especially if you have a bad biology and an advanced disease. The most ideal case is to come early. So the earlier this cancer is detected, the better it is for reconstruction. Very early cancers don't need reconstruction at all because the loss of breast tissue is very little. The problem, like in India, majority of patients come, 70% of our patients come in stage 2, stage 3, and stage 4. In stage 2 and 3 is the most ideal case for reconstruction, where there's loss of a lot of volume in the breast, and many of our patients from India, where our cancers occur at a much earlier age, need reconstruction. In the West, breast cancer being a disease of old women, the indications would be much less. Yes. So what are the outcomes and results of breast reconstruction? I told you the outcomes and results depends upon the immediate complications. If you don't have any immediate complication, late complications are negligible. The only complication which I have seen in my experience is some sort of fat necrosis that can occur. Some parts of this flap which has been reconstructed doesn't get enough blood supply, and so that fat undergoes necrosis. So it can mimic a secondary deposit or a recurrence in the breast. Can be always ruled out with a simple biopsy. The results of breast reconstruction in general are excellent. The only problem with these patients is sometimes the nipple and the areolar complex has to be sacrificed. Then you lose the sensation of that area. And occasionally there's loss of lot of skin also, especially in Indian patients who come from rural areas where they come in an advanced stage. Then when there's loss of skin and nipple areolar complex, there's a loss of skin sensation which can occur. Yes, Mr. Anand, when should one choose breast reconstruction? Breast reconstruction, according to me, should be offered to every lady. If facilities are available and expertise is available. If the patient says no, then it's fine. But otherwise, it should be offered to every patient. When indicated, when I told you, when more than 20% of the tissue is lost. The next question. Early detection and treatment is really very important. Yes, Florence, I fully agree with you. There's nothing better than early detection and proper treatment. As Mrs. Chada has asked this question, will reconstruction interfere with chemotherapy? Was more or less the same question I answered earlier. It does not interfere with chemotherapy. But the timing of chemotherapy can change if there is loss of flap, infection, etc. But it does not interfere with the effect of chemotherapy.
Christine Moore has asked one question.
When is mastectomy done instead of just the lump being removed? When is mastectomy done instead of just the lump being removed? Okay, here we are talking about a different indication. We normally remove a lump in the breast for cancer, an ideal operation to save the breast. But this decision has also to be taken depending upon the size of the tumor to the total volume of the breast, the ratio. If you have a very small breast and a 5 centimeter lump, trying to preserve 1/4 of this breast is of no use. It's much better to remove the whole of the breast and reconstruct it. At the same time, if you have a huge breast and a 4 centimeter tumor, it's worthwhile only doing the lumpectomy. Now, when will you remove the whole of the breast? Is when the surgeon has not studied the mammogram thoroughly. If you have done a lumpectomy, and then when you have reviewed the mammogram, you find additional lesions in other parts of the breast, then there's an indication for a completion mastectomy. Or if the surgeon has gone very close to the lump and you have a margin that is positive, then you should do re-resection of this margin. If the margin is again positive, twice or thrice, then there's an indication for a complete resection of the breast. The other indication is when you have a big lump with skin involvement, then you have to go really wide in these lesions. There may be another indication for a mastectomy in these patients. Is there any new reconstruction option that I should know about? The standard of care today is a deep inferior epigastric artery flap, which is used. But what I have done for patients who do not want a microvascular reconstruction, we can use an implant. Although I told you implants are not used for cancer, we can still use them, but cover these implants with acellular dermal matrix. Acellular dermal matrix is a condition, is a piece of dead skin taken from a cadaver where the antigenic layer is removed. And this skin is processed and it comes out like a mesh. We cover this implant with this mesh and push it in between the muscles of the chest wall to reconstruct this breast. We have done this occasionally at our center. The only problem is the cost of this mesh. A mesh which is just about 6 inches by 6 inches costs about 3 lakhs of rupees. So many of our patients may not be able to afford this sort of reconstruction. Do you have immunotherapy? What is the chance? Yes, there is a role for immunotherapy in breast cancer. So especially when you have your HER2 gene positive. So when you have an HER2 positive, we treat these patients with immunotherapy with a drug called trastuzumab. This has to be given every 3 weeks for a period of 1 year. The only problem was its cost, but at the moment, the cost of this injection has come down drastically. What happens if I gain or lose weight? Losing weight gradually and after exercise is very good. Losing weight suddenly should be investigated. Gaining weight certainly should not be encouraged because every kilogram of extra fat in your body produces estrogen, and estrogen is a cause of breast cancer. So the lighter you are, the better it is. Can someone whose one of the breast has been removed do a reconstruction to get the breast back? Certainly. We can do it. This is called secondary reconstruction or a late reconstruction. It is possible to do this. But the most ideal time to do it is at the time of the initial surgery. But it can be done. Not at all a problem.
I think we can close.
Thank you.